I'm Dr. Ken Miller. I'm the director of the Cancer Survivorship Program at Yale. This is part of a series of dialogues with clinicians about issues that are faced by cancer survivors. Today we're very fortunate to have Dr. Tanoue with us, who is the director of the Thoracic Oncology Program at Yale and an expert on issues that people face with their lungs and with breathing for a whole variety of reasons, including issues in cancer survivorship. Lynn, thanks for being with us.
Sure.
So let's talk a little bit about some of the problems that people may face after treatment's over related to chemotherapy or radiation.
Well, I'm a pulmonologist, so mostly what I see are patients who are at the time of their diagnosis, helping them get diagnosed. And then many patients have problems with their lungs during treatment, and some patients have problems with their lungs after treatment. The lungs are an organ that are particularly susceptible perhaps to infection because they're exposed to the outside environment. So they are the most common site, for instance, of infection, though not necessarily the most common site of toxicity.
Yes, some organs, like the liver, can repair itself. How about the lungs?
The lung does have a capacity to repair, although not to regenerate.
Okay.
So that if there is inflammation or infection, that typically will heal to normal lung. But if there is scar, it's just like if you cut your skin.
Right.
Sometimes the skin repairs and you can't tell there was an injury, and sometimes it forms a scar, and the scar never is normal. It's okay, it's intact, but it's not normal skin. And the same thing is true of the lung and probably most organs.
With the lung, for example, we can think of surgery, removing a portion of the lung. How much lung tissue can someone lose and still be functional?
A lot.
Good.
We have two lungs and tremendous amounts of reserve. We have lots and lots of patients who have had a lung removed, typically for cancer, but sometimes because of infection or the lung is damaged in another way. And those people are perfectly okay, have good, happy, healthy, long lives with a single lung. So there's a tremendous amount of reserve there, and so most people tolerate their lung injuries, whatever those may be, pretty well.
What other, besides, again, physically removing a portion of the lung, what other lung injuries occur because of treatment?
So the two big categories are chemotherapy and radiation. And somewhere between 5 and 20% of people who get one or the other or both treatments have at some point some pulmonary complication of those treatments. There are lots and lots and lots of different chemotherapy agents and a lot of new biologic agents. Not all of them cause pulmonary toxicity. There are some notorious ones that do commonly. Radiation also, though, can cause injury directly. With both of those treatments, you're trying to kill cancer cells, but almost inevitably normal cells get in the way and unfortunately can be damaged. Injured by those treatments as well.
Let's focus on the chemotherapy for a few minutes. What are some examples of chemotherapy drugs? And then perhaps we'll actually talk about a patient.
Okay. So I think the prototypic example is bleomycin. So bleomycin is a chemotherapy drug that is used for things like germ cell tumors and lymphomas and maybe not so commonly now as before. But we know that bleomycin in probably 15 to 20% of patients causes toxicity to the skin and to the lung because the drug is actually concentrated in those organs. And bleomycin can cause an acute inflammatory process, which makes people short of breath. They can get fevers and cough. They look for all the world like they have pneumonia, but it's not an infection. It's actually a toxicity of the drug. If we identify that, we typically stop the drug. And in most cases, that's enough to get the person healing and to stop the reaction to the bleomycin, and people then resolve. In some cases where the reaction is very bad, we will give another drug, like a steroid, to try to decrease the inflammation. In many cases, the lung will heal completely, and we cannot find any residual damage years down the road. In some patients, there is scarring that occurs. It really depends on how severe the reaction was. Many drugs can cause that kind of reaction. Bleo just happens to be the one that is, best known.
Now, does the body remember bleomycin? Is receiving oxygen later a problem?
Absolutely. So oxygen in high concentration creates what are called free radicals. And the free radicals can injure the lung. And in a lung that is already injured from something else, that can create a big problem. So that bleomycin has this very specific issue with exposure to high oxygen, not like in the air, but if you were undergoing anesthesia and you were being breathed for and you had high oxygen coming to you through the anesthetic, that can actually re-incite the bleomycin reaction. That particular reaction can last for years. We actually don't know how long that the potential is there for. So we tend to counsel patients to be careful to remember that if they had evidence of clinical bleomycin toxicity forever.
Yeah. What other drugs in particular should, if people are listening who've had chemotherapy, there are other drugs that do it commonly, like bleomycin?
There are lots and lots of drugs that cause many different kinds of pulmonary reactions. I think probably a better piece of advice is to be aware if the drugs you're taking cause reactions in the lung. We have these drug fact sheets we give out to patients pretty commonly, and unfortunately everything under the sun that could possibly happen is listed on there, but I think it's worth a quick read through just to be aware of the kinds of toxicities that could occur. They're incredibly unlikely to occur. As with all medications, we give people things that are supposed to make them better, not make them sick.
Sure.
And the chances of getting better are much higher than the chances of getting sick. But it's prudent to be aware of the potential toxicities of anything you're taking.
How about the radiation? What kind of side effects do you see?
So radiation to the lung inevitably causes injury, and you can get that same sort of inflammatory response as opposed to a drug that you take through an IV or by mouth where the drug is absorbed to your whole body and so your whole lung is exposed. Radiation is typically given in a beam, a focused beam, and so only a piece of the lung may be exposed to that beam, and it's that piece that then typically will demonstrate injury. And radiation has this peculiar characteristic related to that the injury in the lung tends to be very geographic, that when you look at the X-ray or the CT scan, it's like almost as if there's a line. And that's typically the radiographic hint that the injury there is related to the radiation itself. Often the person is not aware. We can often see that sort of thing on a CT, and the person is perfectly without symptoms. But occasionally they get cough and shortness of breath or fever. And as with the chemotherapy toxicities, we always have to exclude infection. But again, there's that anatomic linear characteristic to the radiographs that tends to make us think of it being related to radiation.
Are people that have had radiation more likely to develop infections later in life?
Not necessarily. Not all radiation injury resolves with scar. And people who have scars related to radiation may have that area of the lung more prone to making sputum and perhaps to getting infected, but not always. We call that bronchiectasis when patients have those sorts of scarred areas in the lung. And some people with bronchiectasis have sputum and tend to get bronchitis and even pneumonia, but many patients don't have symptoms at all and are perfectly unaware that there's a radiographic abnormality there.
All right, so I've got just another question about just keeping your lungs healthy in general, probably for all of us, but how about in particular for cancer survivors?
Well, I don't think the message is any different.
Okay.
Exercise, eat well, don't smoke, and try to stay away from environmental carcinogens like radon and asbestos.
Well, a couple more words about smoking, if you could.
Sure.
Yeah.
There is no question that tobacco-related illness accounts for a huge percentage of cardiovascular disease, stroke, and cancers, and particularly cancers of the lung. So it's really imperative that people who are smoking stop and that people protect themselves from environmental tobacco smoke, if that's possible. And in this country, it typically is. It's very clear that smoking cessation, even into the 60s and 70s, meaning years of life, actually is protective. And you can decrease your lung cancer risk by stopping smoking even way into the middle years of life. A lot of people, I think, have the attitude, well, I've been smoking so long, what's the point of quitting now? But actually there is benefit to be had at any age from smoking cessation.
All right. I think those are important words to end on, and thank you very much.
Yeah, my pleasure.